For successful app usage, 4 different devices should be available at operation point: registration device dedicated for point surface registration, pelvic reference device, femur reference device, insertion device, plane operation table registration device. 5 separate unique colored QR markers are firmly attached to each device respectively. By loading the application, cameras are tracking continuously the position of the QR markers. Separate colors of recognition sphere represent different QR marker and are assigned separately to each device, as long as a colored sphere appears over QR marker's surface. Anatomical point landmarks can be registered by simultaneously touching iPhone's screen. Next, once QR code marker dedicated for the point registration tool is recognized by app and a magenta sphere appears over the respective QR code marker surface. Placing the tip of the tool over the desired anatomical point of interest and touching simultaneously over iPhone's screen or pressing volume up button, enter action. Point is registered. For every 3 points of registration, 3 green spheres appears and centroid position between these points is calculated and a red sphere appear which represents the final registration point. How it works: patient is in decubitus position for total hip replacement surgery. The pelvic reference device should be first firmly mounted on pelvic bone over external fixator device. Once the application has been loaded for the first time, the pelvic QR marker, red, should be in camera's sight and should be recognized first in order to unlock functionality of the app. Next, by placing the plane registration device lying flat over surgical beds at the center of rectangular QR marker, an orange sphere appear. By simultaneously touching screen or pressing volume up button, enter action. A red hazy transparent plane is depicted. Coronal plane in augmented reality. The points that should be acquired for pelvis are always the right patient's anterior superior iliac spine first, then the left patient's anterior superior iliac spine, and finally symphysis pubis. After pelvis registration, 3 planes appear: a green transparent plane, transverse plane, blue plane, sagittal plane perpendicular each other and perpendicular to previous transparent red plane, coronal plane. Anterior pelvic plane is also depicted, defined by 2 anterior superior iliac spines and the pubic symphysis. Hip joint is exposed according to surgeon preference as in conventional fashion. Femur reference device is fixed by appropriate screw, usually approximately in the middle of intertrochanteric line, an imaginary line connecting both trochanters. Once QR code marker dedicated for the femur reference device is recognized, a green sphere over the respective QR code marker and 2 perpendicular cylinders appear conforming the physical femur device in AR. The distal vertical cylinder ending at green sphere should be directed at femur center and parallel to femur neck approximately. Adjacent could be done by simultaneously turning the femur device in left or right direction. The center of femoral head is calculated by moving the whole leg in circular direction in 4 random different positions, and touching over iPhone screen each time. A yellow sphere appear. Each time a point is registered, the number presented at the center of the screen, starting by 4, is reduced by 1 each time, indicating the times left to end the registration session while surgeon is moving the femur, repeating the same maneuver another 2 times each. Likewise, second and third yellow sphere appear. Respectively, the center of femoral head is calculated by calculating the median distance of all these yellow spheres, depicting the center of femoral head below sphere, and the center of rotation of femoral head as red sphere. Without to dislocate surgically the femoral head and by touching with the tip of the registration point device around the ridges of each trochanter. First the major by selecting the highest and most posterior of it, and then the minor. Points are registered. A colorful cylinder appears, and act as a virtual ruler starting from the center of femoral head to the trochanter minor. This distance is depicted numerically in mm as preoperative leg length over the screen. The tandem alternate colors represent certain distance in mm. The interval between 2 overhanging blue discs corresponds to the actual 10 mm distance. Between blue and green disc 5 mm, and between smaller discs in tandem fashion between different color 1 mm respectively. The resection level in mm can be adjusted by pressing the plus or button. A perpendicular red plane in AR is moving accordingly in real time over virtual ruler, and user can see the desired exact level of femoral neck osteotomy in mm. At the point of intersection of red plane and real femur neck is the level of desired femoral neck resection in mm, which can be marked usually on bone with common electrocautery. Following the common surgical steps in total hip replacement: exposure, femur head dislocation from the acetabulum, femur neck resection and femur head removal. Surgeon can finally approach patient's bony acetabulum, and before reaming, acetabular registration should be performed. By pressing the acetabular registration button over screen, the acetabular registration starts. First, at the exposed acetabulum, the anterior acetabular notch should be registered by selecting 3 points at marginal circumference of it by the tip God point device. With same manner, the bony acetabulum rim can be registered, namely 1 in anterior superior lip, 1 in posterior superior lip, and 1 in posterior inferior lip, leaving a light blue sphere. Registering the exposed posterior acetabular notch, this time also a yellow sphere appear. For completion of acetabular registration, the deepest part of the acetabulum should be also registered with same manner, and finally a magenta sphere appears depicting the center of acetabulum, or the center of rotation. Once acetabular device is positioned over reamer handle, the dedicated QR marker is recognized and a white sphere appears over the center of QR marker surface with 2 cylinders in perpendicular fashion conforming the insertion rod. The tip of vertical cylinder ends in a white sphere in augmented reality and should coincide with the mechanical tip of the rod carrying the reamer or cup for insertion. Hip axis is depicted as a cylinder in AR toward to the acetabular center of rotation in case surgeon wants to reproduce the native patient hip axis during surgery without strictly taking into account numerical values of measured anteversion and inclination values. Cup inclination and anteversion in anterior pelvic plane are being calculated in real time, while cup inclination and anteversion in functional pelvic plane coronal plane are also being calculated in real time during reading or cup insertion. Manipulating the reamer or inserter in real time. Values of all above mentioned angles change dynamically. Obtaining positional information and direction with accuracy in real time in augmented reality intraoperatively over iPhones or iPad screen. During surgery, as long as the measured values are in normal ranges, the printed color of values in screen remains green. Otherwise, values are printed in red color. The position of the tip of the insertion device is constantly reflected in real time in a radar screen by highlighting light blue dot in the respective semicircular topographical quadrant area of the dartboard-like radar screen. Dot reflects in radar screen in real time the current position of the insertion tip, location and direction in 3D projection inside smaller semicircular subdivisions areas inside the quadrants of the acetabulum. While inside a semicircular quadrants contained in radar screen, dot size is changing diameter in accordance to the proximity position of tip of the insertion device to center of deepest point of native acetabulum. The insertion depth is constantly measured in mm, namely the distance from the acetabular shell back surface to the tip of insertion device. When tip is over the acetabulum, the insertion depth is 0. 3 perpendicular planes appear passing the center of the deepest point of acetabulum cup towards the anterior superior iliac spine with different hazy transparent colors: sagittal blue, coronal red, transverse green. In augmented reality, depicting the quadrant system in 3D space over the acetabulum. Manipulating the handle of insertion device, the position of the tip of insertion device is in real time presented simultaneous in acetabular quadrant system in screen, namely printing the current position of the tip of the insertion tool in quadrant, superior or inferior, medial or lateral, anterior or posterior quadrant. In real time, the position of the tip of the insertion tool during reaming or impaction is compared with the native the hip center of rotation, namely in medial lateral, depth, and superior inferior, height. Position and absolutes values are given in mm. Medialization lateralization in sagittal plane, depth. In mm superior inferior translation in transverse plane, height. In mm is presented on screen. By pressing the implant button, moving the whole leg in 4 random different positions. Each time of point registration, the number presented on the screen, starting by 4, is reduced by 1, indicating the times left to end the registration session of implant femur. Finally, the center of the implanted head is depicted as blue sphere in AR, registering 3 points each time around the ridges of each trochanter in circumferential manner. First the major and then the minor are needed to finish implant registration. App allows to estimate leg length discrepancy, the difference between preoperative and postoperative distance of trochanter minor from femoral head center presented in mm in real time, and respective messages are presented, namely like longer leg, or shorter leg or okay, no difference accordingly. Femur offset discrepancy is estimated, namely the difference of preoperative postoperative distance of trochanter to major in sagittal plane values presented in mm in real time, and respective messages are presented, namely more offset, less offset. Okay, accordingly femur version discrepancy is also calculate, namely the difference of preoperative and postoperative of femur version, and presented as degrees, and respective messages are presented, namely more or less femoral anteversion. The indication global accounted for same kind of measurement, but the distance calculated are not from the femoral head center but from the respective planes sagittal or transverse respectively.